Welcome to Environmental Concerns, sponsored by Breathe California, which is the nonprofit lung health organization for the state of California. Our guest today is Dr. Tanya Payyappilly, who's the CEO of both the Bay Area um, chapters of Breathe California and the Monterey Bay chapter. And we have a lot to say, given that 85% of California's population breathes unhealthy air, and there's no shortage of problems, as anybody can tell from recent episodes with all the fires in Southern California and the battery uh, fire that we had in Moss Landing that impacted virtually everybody in the Monterey Bay area. So we'll be back with Tanya in 30 seconds.
My name is Rene Montez. I've been using the CPAP machine, I would guess 10 years. I got so accustomed to it, I don't go anywhere without it. I take it with me everywhere. From the moment I put it on, I thought it was the greatest thing because the breathing was a lot easier, and after using it for a couple nights, I felt a lot of energy. Breathe California is fabulous.
Welcome back to Environmental Concerns, sponsored by Breathe California. I'm Terry Trumbull, a volunteer, and if you'd like to volunteer and help with the things you hear about us talking today, give a call to 408-998-5865, and we'd love to have you help us out. So, Tanya, you're the CEO of Breathe California. How did you get involved in all this?
Well, yes, so I'm Tanya Payyappilly, and I'm a physician turned public health advocate, and I've been leading Breathe California for about 6 years now. I've been with the organization. I was personally inspired by some struggles with infectious diseases as I was growing. I had typhoid and malaria. And I also witnessed firsthand some struggles with family members, close family members who had polio and lung cancer, and how environmental factors can hinder recovery. So that ignited a passion for public health and ultimately led me to exchange my stethoscope for a leadership role here at Breathe California.
Are typhoid or malaria a problem in California?
No, it was an infectious, it is an infectious disease, and those problems do exist, but not here in California.
So Breathe California started as the Tuberculosis Society back in 1911. Does the organization do?
Breathe California is a 113-year-old nonprofit organization based out of San Jose, and we fight lung disease in all its forms, and we work with the communities to promote lung health. So the organization runs a variety of local programs to advocate for clean air and public health policies, to provide information on infectious diseases or lung diseases like COPD and COVID. We prevent teenagers from using tobacco and vaping or other new tobacco products that exist in the market. We teach kids how to manage their asthma. By providing a camp, and we also have indoor air assessments for people who need those. Distribution of CPAP machines and other breathing equipment. And we prepare the community for lung health emergencies like wildfires. Currently, we're working on establishing clean air centers, and we assist people who want to quit smoking or vaping, and we also support innovative research.
So we have a lot of strange acronyms in our life. I had a female partner complain about my snoring, and went to a lung doctor who prescribed a CPAP machine. So, since you're the doctor, what does CPAP stand for and what does it do?
So, yeah, sleep apnea is another type of obstructive disease that could, obstruct your airway by the soft tissues behind your nose and your mouth. So when you lie down, it shuts off the airway, which makes it difficult for the person to breathe. But they unfortunately don't know that this happens because it's during when they sleep or when they lie down. And the air passing through that narrow space creates a sound, and that's called the snoring. So it is problematic for some people, but for some they can wing it. They can just not use any machine and be okay. But for many people, it hinders their sleep, and they feel tired when they wake up. Their mouth goes dry. So the doctors suggest that they go and check up for if they have sleep apnea, and we provide these machines which assist people to breathe when they are sleeping. And we have this on a donation basis. A lot of people donate machines to us, and we get them ready, cleaned up, see if they work, and give it to the person, another person who may or may not have insurance to cover the cost of these machines because these are really expensive.
So, I was recently hurt by being run down by a 90-pound dog and went to urgent care, and they told me that I was at 98% oxygen level. What does that mean? And does CPAP have anything to do with it?
Well, first of all, I'm sorry to hear that you got knocked out by the dog, but it seemed like you had good oxygen saturation, 98%, where your tissues and other organs of your body have enough oxygen to support its existence and working of your body. But there are people who get very less oxygen, which would be like less than 95, and the reasons could be many reasons. It could be a heart problem, or it could be something related to their lungs. So you cannot really say unless you do a sleep study or you go to your doctor and have an assessment done.
Yeah, which is what happened to me. I show friends with amusement the night that they had me in for a study on whether I need a CPAP machine, and they had 8 or 9 connections made to me by putting little connectors on to measure Lord knows what. Um, so you and I have been involved in a couple of successes recently. We got a hold of the Santa Cruz County Board of Supervisors to talk about litter from cigarette filters. Um, that doesn't sound like a breathing problem. Why in the heck were you and I involved in it?
Um, yes, that is not a breathing problem, but it's definitely a type of waste problem, which is harmful for the environment and for human health, not just for human health, though there's aquatic life as well, right? And in Santa Cruz. So, and these kind of products can leak, toxic chemicals into the environment. So that was one of the reasons why Breathe California wanted to get involved. And, you went and spoke in support of banning those microfilters. It also could have like different kinds of heavy metals in that. There are a variety of toxic chemicals going into these cigarettes or vaping devices. And lately, I have been researching a lot into what vape-based product is, because that's what we are finding in the environment. And these should not end up in the landfill. There's no ideal way of disposing these, and that's the problem that we're facing currently. So I'm really glad to hear that Santa Cruz County, took on the leadership to ban the microfilters. And
Probably the first local government in the country to do that.
right.
And their rationale was I went on a beach cleanup with Fred Keeley, the mayor of Santa Cruz, and 95% of the waste that we picked up was cigarette filters. Smokers that use them are not very good about making sure they get disposed properly. But talk a little bit more about vaping. What is Breathe California? Well, I guess first of all, if you're not a smoker, I'm not even sure what vaping is, but then talk about what Breathe California is doing about it.
So vaping is another system of delivering nicotine, which is an addictive substance, a drug, into the brain and your body. And a lot of people think vaping is better than smoking, but unfortunately, that's not true. It has more concentration of nicotine in vaping devices, and these can also be called as e-cigarettes or disposables, as they call it among younger populations. So, if one cigarette has 1 milligram of nicotine, there a device, depending on what it is, could have 90 milligrams of nicotine in it and even more than that. So that is the problem, but it's still addictive. And because of the higher concentrations, you don't know how much you're inhaling with a puff, and that can not allow you to quit smoking because the addiction goes in a cycle. It's a cycle. But there are different ways that Breathe California tries to encourage young students to quit this problem by offering cessation resources, behavior modification classes. And last year, we piloted the Smokeless Saturday School, where we used to do this many years in the past when we had funding, but now we do not. So last year we piloted on the request of some schools who had a lot of students from middle school being caught because of vaping, and they were not supposed to have these substances on hand. And the best part of this is the parents are involved. There is a parent component. So at 8 o'clock on a Saturday morning, nobody wants to wake up, but they come in with their parent or parents, and the parents go into one room and the students go into another room. So just the fact that they have that moral support makes them want to learn more. And they sure enough know at that time that this is not good for them, because they would have spoken to their coach and said that I'm not able to quit, or I'm having some kind of lung problems, coughing, and other issues with breathing. And that's the reason why they're there. And they feel that the support is good. And they learn through this, they go through an extensive 4-hour class with us. They learn about what the history of targeting is by the tobacco industry and what they can do. How can they walk away from other peers who are smoking or vaping, and even find other texting resources if they need to by Kick It California.
So we're going to take a break for 30 seconds now, but we'll be back with Tanya to talk about ways that Breathe California is working to protect your health. See you in 30 seconds.
The different therapeutic methods that we can help our very low socioeconomic status clients who have no alternatives, no anything, and there's still about 15 different resources we got out of this, that if you have no resources, no service connection, you can still get aid.
That they are connected, one encourages the other, and that the process of change from backing off from the tobacco is the same as backing off from any other addictive drug.
Everyone can benefit from this training that we just were offered today.
Welcome back. I'm Terry Trumbull, a volunteer for Breathe California. Each week we present a show designed to protect your lung health, and that's a lot broader areas. Smoking is notorious for causing problems in other areas of the body. Tanya, do you want to talk about that?
Yes, as we were discussing, smoking is delivering nicotine, which is an addictive substance or a drug, into your brain, which causes a cycle of addiction. It alters the brain chemistry and makes the brain want more nicotine in order to feel positive or good. And one puff of vape or a cigarette would lead to the next one, and then more, and you're never able to quit. That's not just the thing, because it can also lead to lung problems, heart problems, premature deliveries because of that. And yeah, it also recently we've studied, and research shows that it is now in middle school students more than high school students. So there are a lot of problems related to smoking and now vaping.
So, do you need more volunteers to help with your programs at Breathe California?
Yes, we're always in need of a lot of volunteers to help us with different programs. And Breathe California does a variety of programs that I had mentioned. We have our environmental programs, our asthma programs, the tobacco prevention activities that we do, and also our sleep apnea provisions for equipment. If anybody would like to get to know more about these programs, please call our office, or even to get on our e-newsletter, because we send out an e-newsletter every month and we talk about different kinds of lung health issues. We even go into research that's been published and share that information. And the next thing we have is a webinar series that's coming up, which could be very beneficial if someone's working at schools, their staff or faculty, to learn about how to dispose of electronic cigarette or vape waste.
So, I've done 7 or 8 health fairs in my volunteer activities for Breathe California. What are they, and how much experience or education do you need? I had absolutely none of the training that you have, but I found absolutely no problems with handling things at a health fair.
Yeah, all you need is a mindset of coming and showing up to, enjoy this tabling event. And if we do have health fairs, we usually go for at least 50 or 50 to 60 events in a year. And the reason we do that is to showcase all the resources and provide them to the public. We help about 40,000 individuals in a year. And that was pre-pandemic, and now we're back to like even more numbers. So we provide lung disease information to people who attend these events or their loved ones, and cessation resources. Quit kits is something that we've been giving lately. So all you need to know, and you'll be trained by Breathe California to do how to represent us and talk to individuals, share these resources. And if you have any questions, you can always let them know that you'll take the question back to one of us or our staff and get back to them.
So, who sponsors these health fairs?
Most of these health fairs are done by cities or different organizations, and we partner with them to go and provide our resources.
We also, you and I worked on something that is being voted on by Santa Clara County's Board of Supervisors, which is emissions and problems created by artificial turf. So they're thinking about banning it. Do you want to talk about the air quality issues associated with artificial turf?
Yeah, we're really excited that the Board of Supervisors are planning to tackle this troublesome source of pollution and emission in Santa Clara County, because it's going to have a tremendous impact in all parts of the Bay Area. And artificial turf contributes to chemical runoff, microplastic pollution, and heat island effect, all of which are harmful to the environment and human health. So, but natural gas, it helps recharge groundwater by letting water percolate through the turf, and the plastic synthetic grass leads to water runoff, which is filled with microplastics and chemicals. And those are known as forever chemicals. So these chemicals have been linked to even potential negative health impacts like metabolic effects, developmental effects, neurotoxicity, immunotoxicity, and respiratory issues. So that is why we are passionate about getting this banned. And children are even more vulnerable because of extreme heat conditions, and it'll be very hard for their body to regulate the body temperature as compared to adults. So as climate change increases, the number of days of extreme heat will also change. And playing time on artificial fields will have an increasingly it will limit the safety of these players who participate in the games.
So as a doctor, you want to explain what a heat island is, whether in the city or on artificial turf, and why that creates air pollution?
Yeah. So basically, heat island is when there is plastic in a particular area and we have an extreme heat day. It is not able to, take down or evaporate, and it just the water is runoff is filled with the plastic, as well as unable to take the heat away from that plastic as compared to natural gas, which creates the heat island effect where there is heat just in one area. And the one area kind of spreads off to multiple different locations, which affects a whole city or even the county. And that's why I said we should be more aware of this situation, because it does affect all parts of the Bay Area.
Yeah, this is pretty significant because cities are prone to have heat island effects, which heat islands of any kind create more air pollution. The hotter it is, the more air pollution we're going to get. So you were going to end by telling people how to get help with problems, as well as how to volunteer or donate.
Yes. I will list our information below. But if there's anyone who want to donate or want to know more about the organization, please call our office, or you can visit our website, www.lungsrus.org, and our phone number is 408-998-5865. We also have an email if you would like to inquire about something, about volunteering or donating. It's
Or the webinar as well.
or the webinar series, or even to get onto our e-newsletter. It's info@lungsrus.org.
Great. That's the website that appears on your screen under Tanya's name. So we're pretty close to out of time. Do you want to tell everybody what you want them to remember about our chat?
Yes. So Breathe California is a 113-year-old organization, and we fight lung disease in all forms. And we would like your support, because we work with our communities to fight lung disease and to deliver all the programs that we do related to lung health. Thank you.
Thank you, everybody, for joining us, and come back next week and see us again. Thank you.
Thank you.